Welcome to the Hair Loss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Hi everyone, and welcome back to the Hair Loss Show, episode 56. It's good to have everyone back again after the lockdown period. We'll get straight into it this time. We're really fortunate to have someone that's volunteered to come in and share their story with you. We're really grateful for Marcus taking that time. It's really nice when we can give you something to visually describe what's going on, but if a patient comes in, that really sort of adds to the story. So what we're going to do is we're going to go through the story with Marcus, what's been happening, what he wants to achieve, what's going on, and we'll have a look with the dermatoscope and talk about what's going on specifically in his case and what the plan is going to be. Again, thanks again for watching. Please make sure you like and subscribe the channel. Please remember, we've got a patient. Please, I think it goes without saying that we should be respectful with all commentary, as I'm sure you all are. But on that note, we'll get started. Marcus, thanks very much for joining us.
No worries, thank you very much.
Thanks, Marcus.
Thank you.
So, Russell, first of all, welcome back. I've missed you.
Thanks, and thanks to everybody. I know that it's been a while with the COVID lockdown, but it's good to be back. And just as an intro, can I thank everybody for the great feedback and the good questions that you guys have been and girls have been sending us. We're very excited to have that interaction with you, and we like the idea that we think that the educational side of what we're trying to do is making a big difference to people, and that's the feedback we're getting.
Absolutely.
So, we're going to try and keep finding interesting ways to tell you what's going on in the world of hair loss and how management is moving forward, and hopefully you come on that journey with us. And again, this is a really good example for us to show you what our version of a hair transplant or a hair loss consult looks like. So let's go.
Yeah, brilliant. So Marcus, thanks again for coming in. Why don't we start talking about what's been happening? You're obviously worried about your hair. You've been losing your hair.
Yep.
How long has that been going on for?
I think I've been receding since probably my mid to late teenage years,
Okay.
probably around about 16, 17 years
And how old are you now?
I'm 34.
34.
Yeah.
And has that been happening gradually? Has it been constant, that you've been constantly losing hair, or is it coming
It
and
hasn't
gone?
been constant. It's probably been on and off. It probably stopped a little bit in my mid-20s.
Yes.
And it's sort of been...
On treatment or just by itself?
I was on treatment for about 3 years. I was on finasteride daily. I stopped doing that a number of years ago as I found that the side effects of just being tired a lot and lethargic. I just sort of wanted to give it a break, really. But as I've said, I haven't shut the door to perhaps giving that a go again. Mm-hmm. Perhaps maybe not on a daily basis, perhaps, but having a look at other options too.
Sure.
Just to see where I'm at this point in time in my life. So.
Okay. And anyone else in your family have hair loss?
Yes, both sides of my family, mother and father's sides of family. So, yeah.
And so, for example, your father, how much hair has he lost?
He's completely bald. I think he was bald in his early 20s.
Okay.
So yeah, he was pretty early.
Just looking at, which is the area that concerns you, or what's happening?
I think mostly on the crown of my head,
Right.
and I think it's sort of a little bit happening in a bit of a shoehorn, starting to happen at the front a little bit too.
Right.
So yeah, that's always been a bit of a concern. Yeah.
And are you, if you look at the way your hair is today, and you look at pictures from 12 months ago or 24 months ago, has there been much progression there?
No, not really. There hasn't been a lot of progression at all in the last 2 years, no. 2 years ago, I probably would have stopped using finasteride, I'd say, around about that estimated period of time.
Okay, so my question to you is that we often see patients come in, it's artificial, but kind of two categories. We have the people who come in saying, I can live with what I've got, I don't want it to get worse, versus the patient comes in and says, well, A, I don't want it to get worse, but B, I'd like it to be a lot better. Which category would you put yourself in there?
I think I'm more like that I don't want it to get worse. I want to see if I can explore medications again to see if maybe I see a little bit of improvement again.
Okay, so just to reiterate to you at home, this is a very important question for us to consider and to listen to the answer carefully, because the patient's goal becomes our goal. And if the patient's goal is to keep their hair, then anything we do has to be designed and directed towards keeping their hair for as long as possible. And that's going to be medication, because surgery doesn't do that. So for those of you who think that surgery is a one-stop solution to a lifetime of hair loss, sorry to disappoint, but this is a progressive condition, which is what Marcus is explaining to us. The time that he had a pause in the progression was when he did medicate, and when he stopped medicating, he progressed again. So that's the take-home message. If you want to keep your hair, you have to take preventative action.
I think the other important point to also sort of highlight is that, just because Marcus is going through a period of stability right now, doesn't mean that things may not worsen over time.
Well, we find, interestingly, that if I was to draw a graph, I'll do it with my arm, of what hair loss looks like for most of our patients, it's not that. What it is typically is a stepwise progression where they go through phases of accelerated shedding and they lose hair, and then they have a period of pseudo-stability, what I call pseudo-stability, and then they do it again. And so we see this time and time again, this stepwise progression. Why does that happen? Not sure, but just we are also know that for some of our patients, it's linked to inflammatory activity in the scalp, and that can be episodic. So at times of increased hair shedding, there's more inflammatory action going on in the scalp. And this hasn't been clearly understood yet as to what the relationship is. But when we look at scalps, let's just say with a biopsy, and we look at it under the microscope, about 30% of people with balding scalps show significant inflammatory activity in the scalp. 30%, about 1 in 3. So there's a variability across the spectrum, but clearly this is part of the story for some of our patients.
So, I think the key there is, stability. Like you said, we've got to use medication, but it's, we can't necessarily paint what's been going on for the last 12, 24 months as this is what is definitely going to happen going forward. Good. So you talked about finasteride. You didn't really like it very much. Just unpack that a little bit. What were your issues with that?
I generally just found I'd find myself very lethargic.
Right.
Like I'd take in the morning before breakfast, and by the end of the day I'd just be completely zonked, basically, and I'd be sleeping a lot more on it. I think I didn't notice anything in terms of sexual side effects, but I just think it was mostly tiredness and lethargy and just energy levels that really wreaked havoc on, I thought.
Okay, so this is a little bit of a neuro version, a neurological version of the side effects. So these are less common than the sexual side effects, but they clearly exist. And so the things that people sometimes talk about is the inability to think clearly. Sometimes it's mood alteration, and excessive lethargy and tiredness is part of mood alteration. If your mood has dipped off a little bit, the first thing that usually happens is people start to feel tired and lethargic. So this is an example of a mild neurological side effect. But you won't be surprised if you've seen our earlier videos that we really are not fans of people taking finasteride every day because of the chemistry of the drug. So we have found that in almost every case, if we reduce the dosing, put interval dosing in, put lower dosing in, we can get around most of these relatively uncommon side effects.
Yeah, and so I think that's therein lies the key there. That also you noticed that by stopping the medication, the side effects went away.
They did, yeah.
Yeah. So they can't, even if you do experience some negative side effects, either reducing the dose or stopping the medication, the side effects wash out, and then it's about finding the right balance in terms of the dose that stabilizes you. So you want to keep hold of your hair as much as possible. What we'll do is we will go have a look under the dermatoscope and demonstrate what's happening at the back, at the top, and the front. Right, so if we have a look at the back of the scalp on Marcus, what we can see, this is normal hair. And what we can see on the screen is that the hairs are nice and thick. This is 50 times magnification. And as you can see, hairs are coming out of the scalp 2, 3 at a time. And these are called follicular units. And the hairs are nice and thick, and they've got good pigment on them. And if we compare that with, if we look in the crown, we can see the hairs look different. We can see there are a lot less numbers of hairs per per fixed area. So there are bigger gaps between the groupings. Also, the hairs are coming out more one at a time and two at a time instead of two and three at a time. Also, the hairs are looking a lot less, a lot thinner. There's some finer, wispier hairs there, as you can see. And also the hairs have lost pigmentation as well. If we come up into the mid-scalp where there's a little bit more thickness, what we can see is that there are some thicker hairs there as well. So some good thicker hairs, but again, generally a lower number of hairs per area. The follicular units are generally 1 or 2 hairs in groupings, and if we come up to the front, the same is true there, but you've got a lot more finer, wispier hairs in that frontal hairline. So you can see the miniaturization that's going on. That is classic of male pattern hair loss. So now that we've seen what the dermatoscopic view of Marcus's hair is like, we can sort of go through a bit more with the treatment plan.
So the thing to remember about crowns, which is something that Marcus has talked to us about, is that over time it's not just that the area thins within the area, but the area enlarges. Right, so typically crown thinning starts where the whorl is, where the 360-degree variation in the hair direction happens, and then it expands laterally from there. So one of the things we're trying to do with stabilisation is to make sure the area doesn't enlarge. And if we're going to get improvement, which we sometimes can get if the treatment is initiated early enough, it's mostly going to be at the margins, so we can kind of shrink the bald spot in sometimes, because those hairs that are least damaged, the ones right on the peripheral margin, and therefore they're the most responsive hairs. So that's kind of what we're hoping can be part of the picture, because Marcus said he would hope that he could get a bit of improvement as well. Now, if you look at the figures for finasteride in the crown, about 1 in 3 can get significant improvement, so that really depends upon the degree of thinning, the degree of miniaturization of the hairs when you start treatment. Okay, the thinner you are, the less you respond, so early is crucial. But another thing that we can do, and again, because the crown typically is less bald than the front, so therefore it tends to be more, the hairs tend to be more responsive, is we can use stimulation in there as well. So we would block with finasteride, but we could also add in minoxidil. And these days we're finding that oral minoxidil is a very potent stimulant that has minimal side effects to our patients, but has some pretty good effects. So if you combine the blocking with low dose finasteride and you combine in some minoxidil, and the minoxidil can be, the dose can be varied according to what we're trying to get as a response, then you have a higher chance of having some synergy between those two medicines by blocking, and then you stimulate the blocked hair. If you just use the stimulation by itself, we've got 30 years experience with that, 35 years experience with that. We know it lasts for a while, but not for a long while. So blocking and stimulating seems to be the key if we're trying to get improvement.
That's great. So we were talking about combining the dual therapies, and hopefully the additive effect of both of those, is greater than the individual parts. Do you have any questions that you wanted to ask, or any issues that you wanted to discuss? Because that that sort of encompasses what we'd probably suggest in terms of at this point in time to try and stabilize this as much as possible to stop this from getting any worse. Are there any questions that you wanted to ask us?
No, the only other thing I remembered I've started doing probably in the last 6 months is using derma very lightly, maybe like a couple of times a week. I really only use it very feather soft.
Right, so this is another version of stimulation therapy that people are very keen to use at the moment, because it doesn't involve chemicals. It involves using the natural hair repair mechanisms in the skin to try and stimulate the hair through the growth factors. So the thing about this is also to put in context what we're trying to prove. So when people say to us all the time, well, how will I know if it's working? Well, the answer is, if you came back to us at 6 months and you were no worse than today, we'd say, okay, I don't know whether it's really fully working yet or not, but that's encouraging. Yeah. If you come back at a year and you come back at 18 months and you come back at 2 years and you're not worse, then we know it's working, because typically we would expect deterioration over that time frame. So the thing to remember is that the hair cycle is a 2 to 5 year cycle. Turning the Titanic around doesn't happen in 3 months. So anything you try for 3 months, you're wasting your time, you're wasting your money. If you lock in for anything for a year, you'll start to get an idea. So the first 6 months, we don't see a lot of improvement in many of our patients. But if we're going to see improvement, it's typically in the second 6 months and the third 6 months. So we need to be very clear about that time frame so that you know that if you want to get a result, this is what you need to commit to.
And the dose of finasteride that we'd be suggesting is probably the 1 milligram 3 times a week.
That's it. So less than half what you were doing before, with a small dose of minoxidil thrown in as well. And I've got no problem. Obviously, we've got no problem if you want to continue to use the Dermarol. That works through a different pathway again, so there's no drama with that. I wouldn't keep experimenting on top of that, and the reason I say that is because it becomes so difficult for us to assess, you know, what's really happening if we're doing 5 things at the one time. Okay, so better to do it in a stepwise manner. So if we know the evidence for finasteride is good, we know the evidence for minoxidil is good, and you can put a little bit of Dermarol on top of it. But if you're going to use laser and this and that and everything else, and PRP, then we're going to get confused. So let's just commit for a year to doing it this way, right? And get a reasonable assessment for over at least a year. And if we're not happy with the outcome, let's face it, there's only 3 outcomes that are possible: same, better, worse. The least likely is worse. The most likely is the same. The next most likely is better. Okay.
Great. You happy with that?
I am.
Fantastic. Well, hopefully that's given you some information and put that into context. Thanks again for watching. Remember, please do like and subscribe to the channel. And again, you know, feel free to leave a comment below. And we'll see you again on the next episode. Thanks very much.
Thanks, folks. See you again.